everybody's real favorite is marijuana, because it's such a huge topic right now. And you guys obviously had to do your discussion about that. And I kind of told you guys, be creative, think outside the box, really give good reasons one way or the other why you think marijuana should be legalized, not legalized, only medically legalized, things like that. In regards to the basics, hopefully, again, because it's so common, a lot of the terminology you guys know. But remember, cannabis is that plant, the genus of plant known as marijuana. THC is that active chemical in marijuana. You've got hashish, which is a concentrated resin that comes from the plant. You've also got what's called sesame, which is without seeds, which is how some people will grow more potent marijuana. So that's some of the terminology. But basically, a lot of the things that we talk about with marijuana is kind of like the history and how it's transitioned, and why did people all of a sudden decide it was bad, or is it bad? Basically, again, it just kind of talks about the earliest references are way back, 2737 BC, by Chinese Emperor Shennong. Okay, very social use in the Muslim world, North Africa by AD 1000. Talks about kind of building the case again. In regards to us, the beginning of the 20th century, not a lot of public interest in it. By 26, there was a series of articles associating marijuana and crime that appeared in the New Orleans newspaper, because people were starting to take an interest in it. And in 31, Asslinger became the first commissioner of the U.S. Bureau of Narcotics. Marijuana wasn't really thought to be a national problem at that point. And his thought process was, how are we going to be able to regulate something that can be grown in the wild? He did think it was a concern, but like I said, one of the reasons he thought it was a concern is, how are you going to enforce prohibition of that? Because it's out there growing in the wild. By 36 states had law regulating the sale. And then by 36, so only a year later, all 48 states had similar laws. In 37, they said traffic in marijuana is increasing to such an extent that it has come to be the cause for great national concern. So all of a sudden now it's kind of like in the middle of everything. It's the primary motivation for some of these congressional hearings, and what are we going to do about this drug? There was a huge amount of association being made between marijuana and crime, specifically violent crimes. Let's see. There were some articles that didn't go against it, and kind of like now, we have people on both sides of the fence. But what was interesting is there wasn't a lot of data to back up the fact that they were saying marijuana was related to crime. There wasn't a lot of data for that. But it didn't stop them from pursuing that avenue. And basically what ended up happening, they testified about this story about marijuana induced violence, and it was referred to in a journal. The testimony was referred to in a journal, Journal of American Medical Association. Then basically they would write articles referencing the journal, which the journal had just referenced the the testimony. So it wasn't really a medical journal article where they had done research and things like that. So keep that in mind. One of the other things they mentioned in there, just keep in mind, is the Great Depression. Everybody was very sensitive to a lot of things, especially anything foreign, any foreign substances. And again, what they did was there was this correlation, or somehow there was a correlation between lower class Mexican Americans, African Americans being associated with the drug, and therefore become stigmatized in the white community as a certain thing. So going into the 1930s, you have a lot of fear of this drug. Basically, again, they started to get into some federal regulation. There was the Marijuana Tax Act of 1937. The interesting to note, an official of the American Medical Association actually testified on his own behalf, not on their behalf, on his own, but went against the bill. Was trying to go against the bill. Basically, again, saying it hasn't been proven that this is a social menace, or that this is really causing these issues that you're saying that it is. Basically, that law made it illegal. Possession and use. In 1969, the U.S. Supreme Court found that act unconstitutional and overturned it. Let's see, what else? Pharmacology, again, a lot of this is kind of more common knowledge because people see it more and talk about it more. It's more out there in the open. But when it's smoked, the THC goes rapidly into your blood, distributed first to your brain and then the rest of your body, usually within 30 minutes. Peak mood altering, usually within 5 to 10 minutes. It's going to remain in your system about 19 hours. So after 1 week, well, a certain percentage, but it's going to stay in even longer. So after 1 week, you're still going to have about 25 to 30% of the THC and its metabolites still in your body. Complete elimination is going to take probably 2 to 3 weeks. Let's see. Cardiovascular, increase in heart rate, whether you smoke it or whether it's oral THC. Blood pressure, a little bit more variable. Some say slight increases, some say no effect at all. And so a lot of people will say that there's, is it going to increase the risk of heart disease and things like that? Well, if you're consistently increasing your heart rate, yeah, you might have issues, but there's not a lot of evidence that's going to indicate that connection. If there's something already going on, then they're saying it's probably definitely not a good idea. Like if you already have hypertension or heart disease or something like that, it's probably not a good idea. Reddening of the eyes, dryness of the mouth. It doesn't really have a lot of effect on the breathing except for bronchodilation. Some of the behavioral effects. Let's see. Basically what they end up saying is there's not a lot of behavioral effects. THC's abuse potential is modest at best, just based on one of the studies that they did. There's been a lot of study on the cognitive effects because a lot of people think that maybe it affects cognitive tasks, uh, slow processing, um, disruptive short-term memory, um, disrupted visuospatial processing, all kinds of stuff. Um, let's see. The main thing is when they talk about some of these, one of the big issues we always say with marijuana is there's not a lot of long-term research because this is something that we've really just started researching more recently. And so when we talk about things like, and I think I've mentioned this before, when we talk about things like cigarettes, we've been studying that for a long time. And so we've been able to follow people who have done it for years and years and years, and then see the effects later on and compare it to death certificates and compare it to autopsies and compare it to all this stuff and say, yes, there's a definite link between cigarette smoking and lung cancer. The problem with marijuana is we don't have that long-term research yet. So we haven't been able to follow the people who are habitual users for an extended amount of time and then see maybe what some correlations are with some things down the road. So that's something to keep in mind. But again, as of now, a lot of the research is showing that not necessarily a lot of the things that have been put out there or maybe blown out of proportion. They're either maybe not quite true or really, like I said, have just been blown out of proportion. So keep those things in mind. Medical use, obviously that's a huge thing right now. And they talk about it with using it with cancer patients and nausea. And I think now a big study that they're looking into, I've seen some things on, is Parkinson's, which is the disease where people shake a lot. Being able to calm people's tremors, using it for treating anxiety, all kinds of stuff. But basically, nausea and vomiting is one of the big things that they talk about. Looking at trying to prevent suffering for different things, like I said with cancer, again, the nausea kind of comes into that too, but suffering for cancer, AIDS, things like that, to try to make those patients' life a little bit better. Abuse, the DSM-5 does not recognize diagnosis of cannabis withdrawal. Cannabis withdrawal is not life-threatening, but there are some different things that might come out with withdrawal symptoms. So negative mood states, anxiety, restlessness, depression, irritability, depression, interrupted sleep, decreased food intake, aggressive behavior. And this says usually from like day 1 to 4 to 12 days later, these withdrawal symptoms could present themselves. Most people do not experience those withdrawal symptoms. Most people do not meet the criteria for any of the cannabis disorders. And you probably can. They say if you use a high amount, you're going to develop a little bit of tolerance. But again, they think that has been a little bit over perpetuated as well. As far as acute, they haven't really looked too much at the official like lethal dose. But there hasn't been any human deaths related to an overdose of marijuana. Chronic lung exposure, again, doesn't seem to have the same effect. Doesn't seem to be linked really to respiratory problems or lung disease. But again, we haven't been able to do some of that long-term research, so you want to be careful when you're talking about that. Increased anxiety or panic attack could be an issue with marijuana in regards to a behavioral problem. reproduction. You know, we always talk about pregnancy and things like that when we discuss these drugs. Heavy marijuana use can decrease testosterone in men a little bit, but they're still in the normal range. And it doesn't seem like there's a connection between use of marijuana and low birth weight or anything like that. But one of the things they mentioned there is you got to remember a lot of these people who were tested did not use a significant amount, and as with any drug, it's not recommended to use anything when you're pregnant. Might reduce your immune system a little bit. There's a little bit of research for that. They talk a little bit about what's called the amotivational syndrome, which was a big thing that came out in 1971, basically saying people who smoked marijuana were not going to be motivated. Not necessarily the case. The lab data did not support that. Let's see. And then again, it just kind of talks about some of the, like, marijuana madness. There was a cult classic film called Reefer Madness that came out, and how it was going to turn nice middle class youth into psychotic killers. So again, these things that we're putting out in the media and people are saying is 100% affecting people's views on things. The best thing you can do is kind of what we're doing, and it's researching and looking at the statistics and looking at the studies and what does it really say. And I'm excited to read all you guys' discussion so I can kind of see, you know, what you guys found and how you guys feel about some of these, about the should it be legalized, should it not be legalized, and why. And did you find some good information that's new or different than, you know, the normal stuff that people talk about. And then even the AMA is now like asking them to rethink where they've put it and change it from a Schedule 1 drug. So there's a lot of movement happening right now with this, and like I said, I'm excited to see what you guys found about that. So I'll be making comments in your discussion as I read those. So there's some information about marijuana.